So, you survive a heart attack. What happens next? The big question becomes, what's left of the heart? How much damage is there? Is any of it reversible? For a long, long time, doctors were basically flying blind. But today, we're going to flip the switch and see exactly what they can see inside a damaged heart.
So, here's what we're going to cover. First up, we'll look at what a heart attack actually does to the heart muscle. Then we'll see why the MRI is considered the absolute gold standard for seeing that damage. Next, and this is the really cool part, we'll get into the 3 states the muscle can be in: alive, asleep, or dead. We'll learn the simple rule for reading the scan and then wrap it all up by connecting it to what this all means for a patient's recovery. All right, let's dive into section 1, heart damage after an attack. Before we can make sense of the scans, we have to understand what we're even looking for. What is the aftermath of a blocked artery? So really, all this amazing advanced technology, it all boils down to answering one fundamental question. After a heart attack, what exactly is the damage that's left behind? How much of the heart is hurt? And, how bad is it?
It all starts right here, with a fatty plaque inside a coronary artery. When that thing ruptures, it triggers a blood clot, creating a sudden total blockage. Immediately, the heart muscle downstream is starved for oxygen, and it begins to die. The technical term for that is ischemic necrosis, and it doesn't just damage the muscle itself, but also all the tiny little blood vessels that are woven through it. Okay, so that leads us right into section 2, MRI, the gold standard. How in the world do you actually see this microscopic damage inside a heart that's still beating? Well, you need a really powerful tool for the job.
And that's where the cardiac MRI comes in. Other imaging methods exist, sure, but the MRI? It's really in a league of its own. It gives doctors the most complete, detailed picture of the heart's condition after an attack. It's how they go from guessing to knowing. Now, it's not a silver bullet for everybody. The magnets inside an MRI are incredibly powerful, so patients with most types of pacemakers, cochlear implants, or certain kinds of metal fragments in their body, they just can't have one. But the good news for a lot of heart patients is that coronary stents are typically made to be totally safe for the procedure. All right, section 3. This is where we get to the heart of it, literally. Is the damaged heart muscle alive, asleep, or dead? And look, that's not just some poetic analogy. This is the critical make-or-break question an MRI has to answer for every single part of the heart wall. Okay, so take a look at this table. It lays it all out. Now here's what's so interesting. That first row, wall motion, it's abnormal across the board. The muscle just isn't squeezing right no matter what. So that's not the real clue. The real story is in the next 2 rows, blood flow, or perfusion, and whether or not the muscle can actually recover. Let's look at each one. First, you've got stunned muscle. Think of it like it's in shock after the heart attack. It's dazed. Even after doctors get the artery open and the blood is flowing again, it just stays dysfunctional. Sometimes for days, sometimes for weeks. But the key here is that, given time, it will wake up on its own. Then there's hibernating muscle. Now, this is different. It's not from a sudden shock. This comes from a long-term, chronic lack of blood flow. So what does the muscle do? It's actually pretty smart. It just goes to sleep. It puts itself into this low-power mode to conserve energy. It's not working, but it is very much alive. And if a doctor can restore blood flow, it can be woken up. And then there's infarct. This is the one you don't want to see. This is the worst-case scenario. It's dead tissue, a permanent scar. It will never squeeze again, and no amount of blood flow is going to bring it back. This is the damage that we need to be able to measure. So that brings us to section 4. Decoding the MRI scan. We know the 3 possibilities now, so what do they actually look like on a doctor's screen? How do you tell them apart?
Believe it or not, to understand the basics of a cardiac MRI scan, you just have to remember 2 words. It sounds a little grim, but it is the key to everything. Bright is dead.
So why? Why is bright dead? Well, it's pretty ingenious. Here's what happens. During the scan, a special contrast dye called gadolinium gets injected into the patient's veins. Healthy heart cells just let this dye wash right through them. But dead or scarred cells, they have leaky membranes, so they soak up that dye and they just can't get rid of it. 10 minutes later, when the MRI takes a picture, the healthy muscle is dark, but that dead, scarred tissue is still glowing bright white. But sometimes, right in the middle of that bright white scar tissue, doctors spot something even more concerning, a dark spot. The description for it is pretty stark. An island of dark in an ocean of white. And seeing it is a really bad sign. So what is that dark island? It's called microvascular obstruction, or MVO. Basically, it means the heart attack was so devastating that it completely wiped out the tiniest blood vessels, the capillaries, in that area. The contrast dye can't even get in to turn it white. When a doctor sees MVO, they know the injury is very recent, and unfortunately that the patient's prognosis just got a lot worse. And this is where the MRI gets even more amazing. The level of detail is so high, it can tell a doctor if a heart attack just happened or if it's an old scar from years ago. A recent attack, like you see on the left, will have swelling, that's edema, and it might show that dark MVO zone. But an old scar? Well, it won't be swollen, the muscle wall might even be thinned out, and it will never, ever have MVO. Okay, this brings us to what's probably the most important part of all this, Section 5. So what? What does this all mean for the actual patient? How do these incredible images change things?
This right here, this is where the scan becomes so incredibly powerful. It really all boils down to one thing. How thick is that bright white scar through the heart wall? As you can see from the chart, if less than a quarter of the wall is dead, there's a really good chance that muscle can recover. But if more than half of the wall is scarred tissue, recovery is pretty unlikely. This information is absolutely vital for giving patients a clear, realistic roadmap.
And the scan isn't just about what's happening now. It's also about predicting what might happen next. You see, the danger doesn't stop once the patient is discharged. This timeline shows how the risks evolve. In the first few days, there's a risk the weakened wall could actually rupture. A bit later, a key valve muscle could tear. Weeks later, a painful inflammation can set in. And even months down the road, that scar can stretch out and form a dangerous bulge called an aneurysm. So being able to see damage this clearly, it has completely changed the game. It means better predictions, smarter treatments, and more personalized care. But it also makes you wonder, right? It pushes us to ask the next huge question. If we can see the damage this perfectly, what's next? How do we go from just seeing it to actually healing it?